Ozempic.
That sounded like a commercial.
Ozempic. Yeah.
Ozempic.
Yeah.
Ozempic.
Actually, the first time I heard about Ozempic was from a patient.
Okay.
And I'm one of those people, if I don't know something, I don't know a term, I'll be like, what is it? You know, and this was, I would say like a couple months ago that I was introduced to that word. And then, that's the first time I heard.
What are your thoughts on Ozempic? You've been looking at this in social media. Do you see it around a lot?
I think the Kardashians also did Ozempic.
Actually, I have a few notes that I wanted to say, but I need to find them. One of the things was like, okay, so we all grew up saying, okay, there's two things you were saying, right? You can exercise and you can watch what you eat. And that's the route that I would go personally. At the same time, I don't judge the people that do it. I know there's different reasons. But I also believe that there's people that are doing it for the wrong reasons. And that's like my personal opinion. You getting comfortable there? Yeah. So, because I was like, what are the side effects? Do we know enough about like what is this? What can this do to someone's body and overall health? Not just now, because you can see, changes in 2 months. But what about in 5 years, 10 years? Do we have that data? Like, is this gonna cause other, I don't know, gut issues? I don't know if you stop taking it, would you gain that weight back? Those are things that I was asking myself. But I really don't know the data. I'm just like, I wouldn't do it personally, but at the same time, I don't know.
I have a
What's
feeling
interesting-
Dr. Vincent has that.
No, what's interesting about that is that they found that people taking Ozempic, 40% of the weight loss that they lose with that Ozempic, let's just say semaglutide, is actually muscle mass. So when you're on the Ozempic, you're not only losing fat mass, you're losing muscle mass. Now, what's unfortunate is that they have also found that when you finally stop taking Ozempic, you gain about 70% of the mass back. The problem is that's all in fat.
Yeah, no
So
more
where
muscle.
you lost 40% and it's muscle and fat, you lose the muscle.
Forever?
It's going to rebuild it up.
So
But ultimately, when you gain back, you're gaining back that in fat.
That's
And
not
that's
good.
a big problem.
That's a big problem, yeah. I mean, here's where it gets a little bit tricky because I've gotten into a few arguments with a few patients of mine. Yes, unfortunately. We've had a few arguments with patients. Well, I'll give you two sides. I got a patient, super brilliant guy. He's a business owner, has a big corporation. He comes to my office like, hey, I thought about getting into, selling semaglutide and Ozempic to patients, to people. But when I was looking at the research and I was talking to different people that are prescribing these things, it looks like a class action lawsuit right now waiting to happen. That's how he pointed it out. Again, this is from a business standpoint. Then on the other side, I've had patients that they work in that industry specifically, and they work with patients and their pharmaceuticals or their doctors, and they're prescribing. And they've changed a lot of people's lives where they've lost weight, they brought their blood sugar levels down and everything. So I've seen both sides of the equation. Now, here's my thought. Right? I'm always from the thought process of, if we can do it naturally, let's go natural. Right? Let's exercise. Let's work out. Let's eat healthy. And the body is designed to go back to its normal state, right? But then here's what I'm more concerned about. I don't know if it was a few months ago, Congress is trying to pass a bill now so that Medicare and Medicaid, so CMS, covers Ozempic for patients. That is messed up because that's going to cost us a lot of money. It's actually, I was reading the article, it's going to cost us about $35 billion over the next decade. Yes. Which is messed up, right? Because I understand that Medicare and Medicaid is designed to keep us healthy, especially people that have worked all their lives to pay for Medicare and those people that are lower income and need Medicaid. But now I'm paying all this money so that people don't change their bad habits and they get an easy way out. Yes. I don't want to pay all that money so that we can get them out of the hole for the fried chicken or whatever they ate for the last 30 years.
Temporarily out of the hole because they're going to go right back according to data.
Yes, and this is where it's a catch for me. Because I kind of lie right on the line with Ozempic, to be quite honest. there are many people whose HbA1c levels are at a pre-diabetic or diabetic state. And Ozempic has been shown to be life-changing for them. Okay? What is different now is that people who are just interested in weight loss, who may not be in that diabetic state, they're just overweight. They're fat. Are wanting to take, and let's take it back from that. People who perceive themselves as fat, because they may not even have the BMI associated with being fat, but they have that extra little tire around them that they just don't want to put the effort into getting rid of. And they hear all these people on TikTok and social media who are telling how great and how easy Ozempic is. And that's unfortunate, because my perspective is that, and the way I try to treat my patients as it pertains to this is, you have the right to choice. First of all, we all have choice. If you want to kill yourself or do something negative,
that's your thing.
That's your thing. It's stupid, but it's your choice. But with this, my personal way of treating this is get on Ozempic. If you're going to get on Ozempic, let's monitor your HbA1c levels. When you drop below diabetic status,
you're done.
It's time to get off of those and work in a more natural state. Let's start working now, because I want to get you out of that diabetic state that's not good. Let's get you from that, but in terms of now going from there to what may look better, what may be more sociologically pleasing, that you need to do on your own.
But think about it. These people, they haven't worked out, right? They haven't eaten healthy. They get a drug. What makes us think that now suddenly they're going to be like, you know what? Now that I've lost all this weight, I'm going to start working out and I'm going to start eating healthy. Like, if we don't change, because here's what Congress is trying to do is, it's pretty much patch a problem, but it's a short-term solution, because it's ultimately not designed to reward the people that are actually doing the right thing or doing the healthy stuff.
Rewarding for the purpose of weight loss and making all of it, for me, that lies in the same place as facial reconstruction, breast augmentation.
Cosmetic.
It's very cosmetic. Once you have your HbA1c levels in the appropriate place, the use is now cosmetic.
Yeah, it's cosmetic.
No one should have to use it. Now, for those people who do have these problems because of the foods that we're supplying them, the foods that are available to them, that education that we're giving and surrounding the food, okay, if they need to use these medications, we need them to bring those levels down. To be type 2 diabetes is not great. The problem is, when you are a type 2 diabetic, one of the common things that you see is diabetic retinopathy. And we've already seen that with...
what is that?
It actually messes with your ability. It breaks down your eye. You can no longer... It ruins your vision, let's say.
Okay.
And so the problem with Ozempic is it proliferates or encourage or makes worse the diabetic retinopathy.
There's actually a lawsuit that came out not too long ago. I think it was in Bloomberg. Let me see if I can find it.
That doesn't sound like it's making it better then.
No,
in that respect, once again, this is why I'm saying there's just like any medication, this should be a drug that's well prescribed by a doctor based on each individual patient's need, and not one that you see on TikTok that girl did it.
Only doctors can prescribe Ozempic right now.
Yes, but at the same time, you can get prescribed it over the phone through many companies by just calling in, and they say, how much do you weigh? What is, and then they figure out.
It comes back to what you were saying about seed oil a while ago. We're trusting that you're doing things well. We're trusting that doctors are prescribing.
They're not. They're the same. They
I'm not talking about you two as doctors.
No, but we're the black sheep of the profession. We shouldn't be even concerned about.
What do you know about that?
Yeah, right. That's what they tell us all the time. However, that's the same playbook from the opioids. They did the same thing. This new medication is designed to get you out of pain faster.
There's a movie also.
Yeah, it's another movie, right? So, but it's designed to get you better. It's get you feeling better. Next, you know, you have an opioid epidemic killing 170 Americans every day. I think this sounds like the same thing waiting to happen.
Very similar.
If insurance gets in the way, now they're going to pay for it. There's a big problem. I found the news. Ozempic linked to rare vision loss risk confirmed in study.
Yes.
So again, these things sometimes are going to be rare, but are we willing to risk, right, looking a little bit better for a few months
No, and
to risk our
social media
eyesight?
presents us as one.
Yeah.
Humans need this.
Yep.
What's unfortunate is that we're not one. Once again, I've already explained how Ozempic can affect diabetic retinopathy for people already experiencing it, but it affects your pancreas. And so if you already have a history or a familial history of a pancreatitis, you also shouldn't be on this, because this is going to possibly and usually lead to a pancreatitis.
Yep.
And so when we're looking at social media and it's just like, oh, every human overweight should be on this, it's a beneficial thing.
Which is 50% of Americans.
We're all
Pretty
very
much
different.
everybody. Yeah.
And the problem is also when you're just making a phone call to get, or a Zoom to get your prescription, if I want it,
You're going
I'm
to
gonna
get
make
it somehow.
sure that I tell you exactly what you need to hear. So when the doctor says, "Do you have any familial history of pancreatitis?" No, not at all, sir. What's he gonna do to look into that? You know what I mean?
Well,
Like,
and I feel just like they did with blood pressure medicine, they're going to change the numbers over time. Right? Right now, the BMI, the standard BMI to getting Ozempic is this number. And then as years go by, they start to see the short cash flow. Pharmaceutical companies, they'll say, now the ideal BMI is this number. And they'll kind of move it around just like they would with blood pressure.
But I hear you saying that if it's the only way somebody's going to get out of danger of like diabetes or whatever, then you might consider saying like, yeah, get out of that state, but don't stay in that state where you're saying, hey, just suck it up, buttercup, and do what you need to do.
Pretty much.
Either way it works, but you're empathizing with the people. Like, if you cannot suck it up, if you cannot diet, you cannot exercise, you're not doing that, and you're not going to change anything, at least get below.
Do this.
well,
Yeah.
and it's even more than that, because the people that are in that wheelhouse, who basically start the Ozempic and they go, but I'm going to keep doing what I'm doing. It doesn't matter. You're going to keep getting what you're getting.
I've seen them. I've seen them in
doesn't
social
change.
media.
Your Ozempic use comes with changing diet and exercise. They say it on every commercial. If you're not doing those things, you're going to be right back to square one as soon as you stop.
They say it in fine print. By that, I mean
Probably at the end.
Everything important in fine print. And not only that, but kidney disease.
Holy crap,
So
yeah.
we have your pancreas, your kidney,
Your eyes.
your eyes. How many important organs do we need to affect before we take maybe a more educated stance than reading or watching TikTok and saying, "Oh, she said it was great. Let's use it." And even more so, just to the fact of what it's used for. So the problem is sugar in our diet. But when you have a drug that's specifically pulling the sugar out, and then you also maybe start making changes to pull sugar out, hypoglycemia becomes very prominent. And that's another issue that comes up, which is not enough sugar in your body.
Yeah.
The amount of sugar your body needs.
The one thing I saw is Morgan & Morgan as well. It's in a lawsuit right now. They hired them. They're trying to sue. Same thing. The people that I think it's Norvo, I don't remember the name of the company, but the people that make Ozempic and Mounjaro as well, they're suing them. This patient, they started taking it thinking it was the miracle drug. And next thing you know is they have gastroparesis where their intestines pretty much shut down. They don't work right now. And now they're suing these companies in there. Yeah, that's a big problem. And again, just like that person that just got sued, there's probably 500 more down the pipeline that are ready to sue these big insurance companies.
So Hannah says, how are you feeling about this now?
Yeah, no, it's scary.
No, and here's this. Let me just go ahead and say, before we call it a day, let me throw in thyroid carcinoma. Surprise, that's also a side effect of
Cancer
Ozempic.
in the-
So
Are you still
not only do
thinking?
you get the possibility of having, cancer of your throat, which then makes it difficult for you to swallow. So now you have dysphagia. And so it's not just the
not the
end-all
miracle
miracle
drug.
drug. It's one that needs to be administered with great care, under supervision, and to the point that you need it, and then you stop and you enter into a place where you're using better methods. Your diet, your nutrition changes so that you can improve
But
these things naturally.
It sounds like OxyContin.
And
Let's
right
put it
now,
that way.
God, But right now, it's not covered by insurance, right? No insurance covers that.
Actually, I think they cover it right now, but you have to be like diabetic and things of that nature. But
if you wanna, if I wanna go buy
I think
it,
you have to be obese or
For
pre-diabetic.
weight loss, no, because you not only need to be obese, but you also need to have
Certain conditions, I'm gonna
you
assume.
have to have metabolic conditions like stroke, high blood pressure.
Okay.
You know, there's like you need 2 of these plus obesity. You know, so there's a formula.
And I don't know if it's right now covered by Medicare or Medicaid. I just know that there's certain insurance companies that right now cover it for patients that are candidates for it. However, the moment you bring it to Medicare or Medicaid, we're done, because then you have
So how much money is that company making right now?
too much. Too much, because I've talked to people before. You know, here's the difference between, let's say, Ozempic or Manjaro compared to a semi-glutide GLP-1s peptide, whatever it's called. The difference is the injection, right? What Ozempic made very well is the injection. They have like this thing, you just inject it, you're done for the day. The other ones, you have to get it from a bottle, a needle, kind of pull it out, put it, and it's going to be way cheaper because you don't have the ease of the Ozempic injection. But it's going to be expensive. And here's the problem. Going back to Big Pharma, the biggest problem with Big Pharma in the United States is that there's no... We can charge... These big pharmaceutical companies, they can charge whatever they want. And there's no transparency in prices. You might even get the same Ozempic in, I don't know, China or Sweden.
In Europe, it's like $50.
Yeah.
For the month's worth of Ozempic.
And here's going to be
here
$300
it's
bucks.
No, it's $400.
$400, yeah.
Easily $400.
They're going to make a lot of profit.
All right, bottom line, will you use Ozempic? Yes
Nope.
or no? Dr. Anders, would you use it or recommend it?
No, not at all. I thought about it, and I've sat with people. I've listened to them because they made it sound it's just a peptide. Your body already has these receptors in the body. It can do it by itself. No, it's not good. I've read the side effects.
Take it, would not recommend it. Dr.
No.
Vincent, take it or recommend it?
So I'm different in that, like I said, I would recommend it for a patient who is type 2 diabetic.
Okay.
I would work with them specifically once their HbA1c levels became appropriate. And then I would put them on something that we like to call nature's Ozempic.
Okay.
So we do have a supplement called berberine. And though it uses a different biochemical pathway, it's similar in that it ultimately leads to translocation of GLUT4 into the cell membrane, pulling sugar out of the blood into the cell to be used for energy and burned away. It also inhibits our gluconeogenesis, which is creating new glucose, because of course you don't want more glucose being built out of non-glucose substrates when you're trying to get rid of glucose. It stops fat buildup. It actually encourages or activates a pathway that allows your fat to then be burned for energy. And so there is a natural, healthy, researched method of getting similar side effects. And it maybe requires you to also be more conscientious about the way that you exercise and things. But we have options.
So you might recommend it.
So I would
take
recommend it for the right person. I would not take it. My BMI is not in a place to need it. I get my blood taken regularly, and I read my blood work often, and I'm not in a place where it would be necessary. I don't want to put myself in that place,
So
because you
you're like,
have to
"Don't get
understand,
there," yeah.
when you get to that place, you are sick.
Yeah.
Being overweight is sick. It's not a visual or social thing.
Right.
It's an illness. And we need to look at it as such so that we can then stop it, because the idea of going, oh, that's beautiful. And I hate to say that
Lizzo.
because big is beautiful is a thing. And it's because we don't want people to feel bad about what's happening. But I think of it like this.
Fat shaming.
I don't want people to feel bad about the way they look as a result of the things that they were being told were okay.
Right.
They're eating the
True.
foods they're being
Preach.
told was okay. They're living their life the way they're being told is okay, and as a result, they're suffering. It's not necessarily their fault. So I'm one of those who's like, let's do it in the right way, and then let's jump into some natural methods to then continue the process, so that people can then learn and continue in a healthy way, and not just be on it and then you find that you gain it back, then you get back on it, and then you gain it back. Because once again, cancer, pancreatitis, these are not things to play with.
What about depression? When you find yourself in that situation when you thought you made the best choice, right choice for yourself, and then you let's say you gain that weight back, and then there's nothing you can do.
No, you feel like you've exalted your actions.
Yeah, your emotional state.
And it's rough because you thought you were doing what was right. You thought you were doing what everybody's doing. And then the end result becomes poor. And once again, it's not even like they lost fat and gained fat back. They've lost muscle mass and fat and gained fat back.
Right.
So let's talk about healthy weight loss for a hot second. And this is a question I want to know. We're sitting here with two chiropractors. You work at a chiropractic office. I've always wondered, can chiropractic actually help? Like, can I go to chiropractic and will it help me lose weight?
So my take on this?
No, her take. Her take.
He's looking at him. He's looking at him.
What do you think?
Like, what's your take?
What's your take on that? I don't know. We're asking you first.
It's funny because I do talk about this stuff in a consultation with a patient, and I would say, you know what, you're not going to lose weight by laying on a table and getting adjusted with a patient. Same thing that your IBS is not going to be cured if you just get adjusted right now.
Right.
Or somehow your asthma is going to be cured. You name the disease. But I know that a nervous system that is working right, your body's going to do what it was designed to.
Mm-hmm.
That's where I put it. Like, we would never go out of our way and say, get chiropractic care because then your vision is going to be restored, But I know that your body, you need to give the body the tools. Just like you give them the right food, the right amount of exercise. You're being proactive, making sure that your spine is aligned because it protects the most important organ in your body is your nervous system, is your brain, your spinal cord. So that's what I would say.
So indirectly, yes, but not directly.
Yeah.
Yep.
And I know because that's not something that we can say, I mean, we know our limits, but I know that it's one of the tools.
Well, people are always, even if somebody laid on that table, we got them better and they lost weight, they would never admit it. They would never say it's chiropractic related. They'll always say it was because the weather changed, and it's like.
I feel like you've had this experience before.
But I'll say, in the same respect, yes, keeping the body in alignment gives the body everything it needs to send the proper signaling from the brain through the spinal cord over the different organs and tissues so that they operate. But at the same time, what a chiropractor brings to the table that I feel is different is we listen to what's going on. I don't get stopped at the symptom and go, that's what I'm correcting. I listen to what's going on and I try to figure out what is the root cause of that symptom and what can I do to make a change in this person. And I think that's important for my career because I'm not just there to pop and crack somebody. And if I can sit down with a patient and explain to them through my knowledge what supplements they can take to facilitate weight loss, and there's plenty. For instance, activating your carnitine shuttle to take the stored fat your body has, use it as energy, similar to a keto diet, or give them any of the information or tools that I have picked up that then they can use to implement change is important. And part of that are some hacks that I like to pass along to my patients. One being that you should start off your every day should start off with savory breakfast.
Oh, yeah.
If you start off with a savory breakfast, which means omitting your orange juice, omitting your coffee if there's sugar, omitting danishes and pastries, you're going to reduce the glucose spike that you experience. And if you reduce that glucose spike, the chances that an hour later you're going to reach for a donut are minimal. And if you don't pick that donut up, the chances that you're going to lose weight are
way higher.
Enzo agreed about that.
Yeah, it's like, and one of the things that I see with a lot of our patients is we get into New Year's. I've looked at the data. The most common New Year's resolution that people have is losing weight. The second one is getting their finances in order. But when we talk about losing weight, there's, like we said, there's two simple ways you can do it. Either you eat healthy or you work out. Right? If somebody has a back injury or their spine is struggling, they don't have stability, they cannot work out. The moment they work hard and they get injured on the first week, they're done for the rest of the year. So one of the things that we want to do as chiros is to make sure that their spine is in alignment, that their muscles and ligaments and nerves are firing properly so they can actually do their workout. So that way when they start working out, they don't feel like their body got in the way of them getting better, which is one part. The second part, yeah, you might eat healthy and everything, but we already know as chiros that your spine, that's all the same nerves that control digestion. So if your nervous system is not able to absorb the right nutrients, it doesn't matter what you do, you're gonna throw that out all the time, right? And that's what we call the intestines, the second brain. Essentially, there's a lot of nerves in there. So as chiropractors, are we directly tied to weight loss? Probably not, right? But is there a difference when you're getting adjusted versus not getting adjusted? Absolutely. And we've seen the research also or data that shows that when people get adjusted, the inflammatory or stress response goes down. So when you bring the stress response down and you take the nervous system, right, from fight or flight, right, there's a tiger chasing me, to rest and digest where there's no tiger chasing me, then ultimately your inflammatory levels go down and therefore you're able to, you lose weight. I mean, when we change our diet to more carnivore or animal-based diet, where we're eating literally ribeyes and ground beef and eggs and avocado, we could look ourselves in the mirror and take that puffiness in our eyes and our face and our bellies. It just literally went away. We lost that water weight, the inflammation, we had less pain, we could sleep better, more energy. So it went back to the nutrition aspect. So
Better sleep.
Way better sleep, right? I thought it was bullshit, but it's not bullshit, right? The moment I changed my diet, we're getting adjusted, we're doing these things, we're able to make a better year, you know?